Do you want to know exactly where people are catching COVID-19? That's the question, because a piece rather in Blog TO points out that although we know which cities are hit the hardest, we don't always know where the virus was contracted. So do we need that specific information, the where?
Well, I think what we need to do is look at exactly where we're at. So right now we're seeing numbers that are starting to rise again. So it's important that we all strap down and do what we did in the beginning to ensure that it's being contained and that we're all doing our due diligence. This is something that brought us all together in the sense that it was an obligation that we all had to be accountable for. The idea of naming like a specific venue, like a gym or a bar, or I think that if there's an outbreak, yeah, definitely that information should be. There shouldn't be any shame in if someone gets it. It's not their fault. You don't get it for a particular reason. But we also want. I think the most important thing is so we don't get into like social stigmas. So people are afraid to go to a gym or afraid to do dining in or any of that kind of stuff. I don't know if we want to be fighting social stigmas and fighting a virus at the same time, but we do have to be 100% responsible. I'm hearing commercials as I'm driving in the car about schools being open but not prepared. So I think the most important thing is that everybody's doing their part and it's really, really, I think we all kind of got a little relaxed in the last little bit, but it's important that we get back to what was working. And yes, I do think we should name some places specifically if there's an outbreak, if it's going to help. If it's just going to create a cool blog post, no, keep that. I don't need that. I don't have time for that. But if it's going to help someone and it's going to then cool. Yeah, let's get that information. There should be no shame.
Yeah, it's interesting that you talk about shame because I think it's a multi-layered word. And when I think about the fact that businesses we already know are really struggling and that there could be sort of, if there's an outbreak that takes place there, that there could be some stigma attached to that. That gets complicated. My brain just immediately goes when you say the word shame, though, to the fact that there's been these multiple outbreaks at strip clubs. And I mean, already these strip clubs in this city in particular have only been open for a few months. And already there's been 2 major outbreaks that have impacted combined around 850 people. I mean, it raises so many interesting questions. Not all of the clubs allow for lap dances, but some do with masks on. How can you socially distance during lap dances, even with masks on? It raises many questions. And I mean, the guidelines are that you are supposed to be, these institutions, these businesses are supposed to be taking down names and having contact information. Turns out a lot of that contact information was either not put in properly into the customer log system or had inaccurate or incomplete information. So how many of those patrons of those places are going to be going home and self-isolating if they know that they were there? How are they going to explain it to their partners? How are they going to explain it to their families? So, I mean, it's just one of many examples where even when you have the information of the name of the place and where the outbreak took place, it doesn't necessarily mean that people are going to be then protected from there.
For me personally, figuring out and isolating a certain spot or wherever where an outbreak occurred or people were infected is less important to me than just the overall information, which is the daily numbers are climbing, especially where I am and in many other places in Canada, which tells me that the pandemic is nowhere near ending and that I still need to do what I've been doing, which is basically staying in phase 1.5 or 2. Like I don't do much at all. So that is my personal approach to it. I don't need to get granular on the data. I don't need to have it isolated down to the very block because frankly, for me, what's that going to do? It's not going to really change my precautionary living. But I also wonder, like, for the people who are already being cautious, do you need that information? The people who are like, yes, we need to know. I think that you're already of the attitude that you're taking care of yourself. If you're that conscientious about it. It's the people who aren't conscientious and who are being not responsible and not wearing masks and still going out and partying. Are they going to care about like locating it to a certain block? I don't think so. I think that is the better question, how we get to those people.
I was going to say that as well, because we know that 67% of the new cases, at least in Ontario, are people under the age of 40, specifically between the ages of 20 and 39. So yeah, we need to be targeting the information that's coming out. And that's where I do think getting granular does matter, because if you know that it's a specific demographic that's really behind the thrust of the new numbers, you've got to target them somehow, some way. But where I do think it's important to know things in a neighborhood by neighborhood basis is what Tyrone was mentioning, back to school. There are, thank goodness, interactive real-time maps that you can find online, at least for Toronto, that shows the cases, the active cases in ward by ward by ward. My ward is consistently either at the top or the second from the top in terms of number of cases. And why does that matter? Because I'm a parent. Why does that matter? Because the schools that are in these higher risk areas, that's going to potentially change a parent's decision if they have the option to put their kid in school or not. And this is the perfect time. We have seen this massive shift of parents who thought they were going to put their kids in school, and to the tune of tens of thousands are pulling out and saying, whoa, this is not safe. And so I'm going to go virtual. Hence delays of starting up virtual schools. So in that case, that information is vital to the health and safety of my child. And so I do want to know those numbers. And the other part of this, you were talking about stigmatizing, Tyrone. I do think that when you look at those numbers on a map, then put the resources in the areas where it's harder for people to social distance. Get those rapid testing centers into those areas where it's hard for people to maybe access assessment centers. We know what we need, so let's put it there. This virus is not new to us anymore.
Yep.
Yeah, absolutely. It's not new to us. There's still a lot of questions around it. And I think when there are questions around something, you have to look at what you do know. And what we do know is the other W, and that is why. When numbers were lower, we were doing certain things. And the problem is we're not adhering to those things. So when we do the right things, when we physically distance, when our bubbles are tight, when we wear masks, as Lainey mentioned, good things happen. We're seeing numbers go up because we've gone away from that. So it's the why that I think we have to focus on. We've got to adhere to certain things and put the whole idea of wanting to get back to our normal, whatever that is, and just think about what we have to do and stick to it.